sometimes trainees, as I mentioned earlier, are trained, but when you get to the field, you realize that you need additional skill sets. And therefore, that information can help in continuous revision of training programs and curriculum and incorporating new areas that probably we would not have thought about. International organizations have a critical role to play in terms of also bringing the element of harmonization. You will find, for example, we need to interact a lot as a region. And you'll find some trained workers from one country moving across the region and providing services. And therefore, harmonization of training program is very critical. And therefore, some of these organizations may help in terms of bringing institutions together, the regulators, so that you can be able to harmonize programs so that there can be reciprocal recognition of professionals across the region, which is very critical. The final thing that I would like to say is about the issue of innovations, because we need to keep innovating and looking at different models of training, because one of the things that I think we keep learning is the issue of brain drain. You train, you spend quite a lot of funds in building skills, and then when you need those particular professionals, then they get greener pastures elsewhere, and you cannot avoid it because better terms are provided elsewhere. But if you look at innovative models of training, then we can be able to retain and maintain human resources for health within the region. The reason why I asked to project this slide is because as EXA Health Community, our Health Ministers Conference approved establishment of a College of Health Sciences, that is an umbrella college of constituent colleges that have been established over time since 1990, where the EXA College of Nursing was established that helps to build skills within the region for especially in hard-to-reach areas, and uses a model called collegiate model. Of course, the graduates graduate with a membership or fellowship. And one of the observations that we've had is we did a retention study, and we found for those persons that have been trained within those facilities, we've been able to retain over 90%. And so we have 11 colleges already established, and more are being established going forward. The College of Surgeons is one of those other colleges that was established in 1999, and other colleges have come up, and anesthesiologists, College of Oncologists, and so on and so forth. And this become very critical because these are the skill sets that you find in different hospitals, because they are trained within those hospitals. The hospitals are accredited, and they train these staff, and they continue offering the services within those places. And we have been able to retain quite a number of them through this innovative model. So we can share more about this as we work together in making sure that we build skilled human resources for health. Thank you.
Okay, thank you.
Yeah, thank you. Maybe just add a few addition to what he said. I think at least the lessons we are learning is we need to be comprehensive. So before you even bring people on board, you need to understand why are you training those people, who do you need to train, and for what. So yesterday I was discussing with someone, and I told him that in Rwanda when we responded to COVID, it was like a military response. We really attacked that virus as any threat to the country. We had the police, we had the army joining the command posts. And if you're training people to respond for an enemy, we don't know when it's coming. So we need to train the existing people in service already, and then have plans to train the juniors that are coming. So I think you have to separate the two. So if I'm training in-service people, who do I need on board? Which package do I give? And who's interested in training these ones? And if I'm training the pre-service team, who's coming on board and what is the package that I need? Because these trainings have to be timely. You don't train when the pandemic happens. That's what we've been doing, but that's not what we should be doing. We should train to prepare, not to train when it happens. So they have to be timely, they have to be targeted. As colleague said, you have to agree on the training package you give to each group. If these are lab tech, give them the specificities they need. If this is community health workers, just target and tailor the training materials to the different groups. But also we need to be consistent, because if we don't know when the threat is coming, so you keep training. We talked about ECHO, we talked about those platforms that will allow us to continuously provide knowledge to our teams. So in terms of collaboration, I think it's important that you understand who comes when, depending on who you're training. But also the One Health approach. When we talk about training, the MOH leads it, we train nurses, we train lab tech, but there's a whole world, animal world and wildlife that needs to come on board. So as we plan trainings, we need to do it together. As we find partners, we need to do it together. As we evaluate the progress, we need to do it together. So I really cannot emphasize enough how this comprehensiveness is important at this point and very critical to make sure that we have a plan that works.
Okay, thank you.
I'll be as brief as possible. So I'll take this as a two-parter. Collaboration is imperative to ensure quality of whatever it is that is going to be used in the training platforms. And secondly, to provide harmonized contextual trainings, as Dr. Matu indicated. But now the angle that I'll take for the second part is within the industry ecosystem. Health security comes in the form of having people who can be able to actually manufacture quality products to respond to any pandemic matter. And within that particular space, the vaccine ecosystem has identified regulatory, research and development, manufacturing itself, and academia as being 4 pillars under which we can be able to provide harmonized continuous training. And of course, this is going to lead to academia changing a few of the things that they're teaching to be able to respond to industry providing spaces for people to actually come and learn through experiential learning, R&D responding to public health matters, and then finally the regulatory space strengthening itself to ensure that it can be able to assure the people about the products that will be coming. So by and large, at the end of the day, we will be in a position to have persons who are competent enough and confident to be able to produce vaccines and biologics that can be able to be used in a health security manner. Thank you.
Okay, thank you very much. And I've been given 5 minutes to close it up. And there are those that are in trading space, and I want them to give at least what they've learned and what we should do into the future. Thank you. Dr. Kisia.
Yes, thank you very much for this opportunity. I think for me, this conversation emphasizes the critical and central role of collaboration. And I think yesterday we talked about digital learning. And from a Project ECHO perspective, the platform is available, it's tried and tested, the evidence base is there. You've had a number of people mentioning how they're using it. It's available for free to partners. The technology, the training, the iECHO platform, the ongoing support. Let's make use of some of these tried and tested systems to make sure that we can strengthen digital learning for preparedness across the continent. Having a digital learning strategy and prepositioning the technology in advance is critical so that we are not scrambling when we have outbreaks. Thank you very much.
Thank you very much. To learn more, visit their stand.
Thank you very much. I think one area that we need to really cultivate is generating fit-for-purpose doctors. Fit for purpose. Globally, these challenges will continue to face us, But you need to advance that curriculum into a living curriculum, putting in molecular science, making it a work culture to be looking at data. So data science and its application. Cross-learning. I'd want to learn from Uganda. What did you do? What are you doing in Mozambique? What are you doing in Kenya? The cross-learning so you can have problem solving that is co-created with homegrown solutions. And the last thing is to really engage clinicians to move from just the mechanical healthcare, but being part of the conversation in innovation.
Thank you very much, Prof. And trainers.
Yeah, thanks for the opportunity. I think this conversation really emphasizes the need for contextualized training in preparedness or during peacetime, and the just-in-time training for outbreak response. Quite often, and we all can attest that during outbreaks, sometimes a healthcare worker you trained in a previous outbreak can actually run away from a case in another outbreak. So the just-in-time refresher training is important. So the digital platforms that came up in the discussion are quite key to deliver such trainings just in time, but also the contextualization. Quite often you need to adapt material every time during an outbreak. So some of the training materials need to be adaptable, and we need to put in context, flexibility for contextualizing within any other outbreak. And then lastly, monitoring the effectiveness of training. Quite important, and I think it came out clearly that we also need to put up structures for monitoring the effectiveness of this training and inform, subsequent training. Thank you.
Thank you very much. I close with Ambrose.
I think this is really a very critical topic, and I think this forum will serve us to move a couple of things forward. You asked for some actions, and I really think that both for pre-service, in-service, and what I would call orphan cadres, we probably need some kind of landscape analysis, some kind of survey, market survey of what is out there in terms of curricula. If I look at, for example, EVD, Ebola alone, 10 years ago, and if you know what we know now, the content has changed from transmission, modes of transmission, follow-up of survivors, and a lot of things have changed just for Ebola alone. Mpox, if you look 5 years ago, what we know now is so much. So if really somebody can do a landscape analysis of the curricula that are going out there on global health, what is in them and how contemporary is it? The second is, for me, of the health workers that are out there. And for COVID-19, we realized what we have really called orphan cadres: procurement, supply chain professionals, logisticians, mental health and psychosocial experts. The previous session here was talking about anthropologists and social scientists. We don't have them there. There are very few. And for example, mental health and psychosocial support experts, we learned from EVD in West Africa. But for COVID, it affected every family, every community. I was in Zambia and in Dola. You have health workers, they know what to do, but they don't have high flow oxygen and the patient dies. They are depressed. And on the incident management team, I didn't have any mental health and psychosocial support experts. How do we churn these out over the next couple of years? These days, we are saying on my incident management team, I need somebody, gender-based violence, prevention of sexual exploitation and harassment during emergencies. Do we have them? Can universities start churning out these groups? So I really think the starting point, which could be a follow-up for this forum and this summit, is that kind of landscape analysis, and we have robust statistics. For in-service training, and it's good, my colleague from ECHO has spoken. At the beginning of the COVID-19, we were trying to roll out a training program. At that time, I was in Brazzaville. And yet, that's the time when lockouts. In fact, the initial trainers that we had brought into Brazzaville were locked in Brazzaville because they couldn't go back to their countries. There were lockdowns. There were no flights. And then we partnered with the University of New Mexico and had the most unprecedented WHO training, virtual training program. Probably a couple of you were reached. At the Zoom capacity that my boss, Casolo, had at that time was 500 people. When we partnered with the University of New Mexico, we could reach 3,000 people in one session. How can we exploit these technologies? This is the COVID legacy of virtual training programs. I mean, there are areas where we need in person, but there are certain scenarios where this is really should be the new model for in-service training moving forward, and it is cost effective. And I really want to support the ECHO program and what the University of New Mexico when we pattern from this. But really, I think we need a critical landscape analysis of what is out there and what we need to put there. Thank you very much.
Thank you very much. Our time is up, and I can see I've only, somebody wants to say something. You know, if I don't allow him to speak, he will go and have me fired. Eh? Yes.
Wow, thank you. Following up on the last comment, I think I want to say let's medicalize and demedicalize our training. Because if we bring in One Health, it means that we'll now start focusing on the bio-psycho-social approach to medicine. And that will be very helpful. And if we do that, then also move to another level where somebody mentioned, let's design our curricula with the industry. Thank you.
Thank you very much. Thank you all for being good listeners, and we'll continue the discussion outside there. Thank you very much. Thank you, Palenis.
One final round of applause, ladies and gentlemen. That's the final bit of our breakout session. Thank you so much. Thank you. Welcome back to this session, which will be our sort of last panel for this 3-day summit that will lead into the closing ceremony, ladies and gentlemen. Thank you very much for being here. I would like us to scan the QR code that is on stage right now. I'd like us to scan the QR code, please. This is a feedback form that we encourage you to please scan, share your feedback, give us your comments. How do you feel about the summit? Would have loved to pass the mic around, but maybe we can put it in Word. Let's see, is it visible? You can see, is it clear? Yeah, right at the back. Please confirm, pops up. It looks a bit blurred, right? All right, Harry, let's redo it. It can't be visible on this side. So maybe we can just redo it and get a better resolution for it. So thanks for the feedback. If it's not able to load, so we'll take that again. All right, let's try that. Let's try. Okay, push it up a bit just so that we can give some allowance to the seats in front. Up, 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 up. Jew. All right, much better? Awesome, awesome. Thank you. Please can share your feedback. Let's build back better. All right. Anyone who's managed to get it? It's working. Okay, it's working. Thank you. Yes, maybe change the machine. All right. Thank you so much. Thank you. Please share your feedback with us, ladies and gentlemen. We appreciate you for being with us for an entire week, and we'd love to hear from you. The way forward, collaborative strategies for future health securities and summary of key outcomes and the next steps. Ladies and gentlemen, as I mentioned, this will lead into our communique and indeed the Mombasa Declaration. To lead this discussion is none other than Dr. Amit Thakkar, who's the Executive Chairman at the Africa Health Business. His 30 minutes start now.
Yes, I think this is really putting the icing on the cake. We need to discuss what happens after we leave the room here. And I have a fantastic panel, which I'm going to introduce and call them up. And after that, we're going to have a communique. As you fill up your feedback form, some of the points that you're writing there are going to be captured on what is our action plan going forward. This panel has got people from the private sector, the government, and the academia, and our chairman, Emmanuel, refers to this as the triple helix structure that will give you the final way forward. Let me invite Tamari Rotich from the AMREF International University to please come on stage and give us a brief setting the stage before we take off the panel. Please put your hands together for Tamari.
Good afternoon, everyone. So I have the pleasure to do a short presentation setting the stage to the conversations that will follow. And this is on the topic collaborative strategies for future health security and summary of key outcomes and next steps. And this is also targeting or anchored on the concept of triple helix that we've had the conversation since we started the first day of the summit. We need to advance the triple helix thinking. So from the conversations that we've had with the various presenters, we know that there's a varied context within Africa when it comes to global health security. The global health security program that we plan to enhance, it will be addressing some of the issues that we have already discussed, including inadequate healthcare infrastructure, limited disease surveillance and reporting, insufficient emergency preparedness, weak health systems, access to vaccines and medical supplies, and also the issues of protection of health workforce. So it is crucial that we come together collaboratively to invest in robust health systems that not only safeguard the well-being of millions, but also fosters regional and global stability and economic growth. One of the first things that we're looking to do as AMREF and as AMREF International University, and these are the actions that we plan to take forward post this summit. We are going to be rolling out training or a focus on health workforce development, and again, really for health system strengthening on global health security thinking. And when we are thinking about this, this is going to be addressing a number of things. We know that within Africa, we have only 3% of global healthcare workers. We have over 400 million Africans who are in need of quality healthcare services. We know we have high mortality rates in diseases, as well as new and emerging threats that we've been discussing about, including climate change and health, amongst others. So it's crucial to have a health workforce that actually will support us in addressing these issues. We plan to do this by launching a call for applications and also for partnerships, possibly a few days after the summit. And this is going to be a call for a global health security short course targeting frontline healthcare workers, global health security fellowship, targeting again government institutions, national public health institutes and others, and also a global health security masterclass. So these are opportunities for each and every one of us, and also from the institutions we work in, to encourage that we should have various members of our institutions undertake some of these courses. And something important also from the conversation we've just had is that when we are working, for instance, with community health workers, they don't want to be community health workers for life. So some of these programs are going to be targeting career advancement for individuals working in the public health space and global health security space. So I want to also speak about the catalyst that this program is going to provide. It will be a platform for sharing experiences and learning, like the way we've done in this summit and in the various summits that will follow. It will also be supporting some of the engagements we've had pre-summit, including global health security dialogues. We already conducted 4 dialogues that were looking at the role of community health workers for pandemics. We also did one on innovation technology and data, health facility preparedness, policy, and advocacy. So we plan to advance this further, having those conversations as we move forward. We also, of course, I want to recognize the partners that have been supporting us in this engagement pre-summit, and I know also post the summit. Of course, UNMC, we've had AMREF, we've had other partners like LVCT, the Jumuiya, County Zapwani, Africa CDC, NPHI, amongst others. The second initiative is going to be looking at innovation, technology, and research. And this is because we know that as Africans, we can create scalable homegrown solutions. And again, data comes in very handy because we need the evidence that will inform our policies and programs to tell us what to do. From the conversations earlier, a simple example that I can give is that on manufacturing. Where are the gaps on manufacturing? Who is doing what and where? And this is going to help us to chart the way forward when we're discussing gaps and opportunities on manufacturing for the African continent. And then, of course, we plan to launch a Global Health Security Hackathon. And again, this should be in the next few days. And this is going to be looking at the solutions at the intersection of primary healthcare and global health security. And again, we are looking for those innovative solutions that we can take forward, partners, and also private sector who can support us to take this forward. The next action is around an enabling global health security environment. We know again that Africa region faces complex and evolving health challenges, climate-related, non-communicable diseases, neglected tropical diseases, and we have also a lot of gaps around policy and frameworks that are supporting global health security. So we need to understand our policy environment, and then we should be able to address some of those gaps with concrete actions around policy influencing and implementation. One of the things I wanted to mention is the new pandemic agreement on prevention, preparedness, and response that is currently under development. And this, what does it mean for states, and also what does it mean in terms of how we can plug into that to influence that policy development and adapt it to make sense within the African context. Again, a call for partnerships and collaborators to help us to do that. The final thing is on the global health security financing. A lot of the challenges that I've already mentioned within the African context tells us that we need to have robust, sustainable resource mobilization and funding models for global health security. Again, we were implored by the former president yesterday in his speech that we need to be self-sustainable when it comes to funding. So here, again, a call to partners to join us to begin to brainstorm and think collaboratively what kind of model is going to work for our context and what do we need to ensure that there is access to funding for the African states. Allow me, moderator, as I conclude, to appreciate the team that has been working tirelessly from AMREF and AMREF International University, and also the other partners that have supported us for the pre-summit initiatives, to stand so that we can at least appreciate them. I know I have a bunch of students from the university who've supported in rapporteuring, in some of the logistics within this conference. If they can just all stand. And of course, as I leave the stage, thank you very much, I want to speak about our new campus, which will be a growth catalyst for health workforce development. We are moving to the Northlands. In May of this year, we should be doing a launch, and again, we'll invite all of you to support us. And this is going to be an opportunity to really expand health workforce training for Africa and also specifically for global health security. Thank you.
So please give her a round of applause and a real thunderous applause to all the partners who've been working hard from the first day that we came. And whatever we're going to read and share is going to be an output from the rapporteurs that we'll see. So please, once again, thank you so much, all of you, for the work. I hope you've also learned from the experts who have come from our neighboring countries, who've joined us and shared experiences. Please join me in welcoming the panel. I'd like to now invite James Fowler to come and join us on stage from the University of Nebraska, one of the champions and one of the co-visionaries of getting us here. So please put your hands together for James as he comes through. I'd also like to invite Mr. Mugo Kibati. Mr. Mugo Kibati has joined us. He's the former chairman of BioVax. He's also the former DG at Vision 2030. He's now the leader at Telkom Kenya. So please put your hands together as Mugo takes his seat. Joining me on the panel is now the lady in charge of the 14 countries through Africa CDC leadership. She is in charge of the RCC, Africa CDC East Africa. Lucy Mazaba to come up, and Lucy will take on the stage and join us on the panel. So ladies and gentlemen, please put your hands together for our champion of Africa CDC, who's been with us from the first day, and joining us on the panel is her guidance as we also talk about different. In a few minutes now, in the next sort of 20 to 30 minutes, we are going to really ask reflections from the respective champions here, and we want to then close with a wrap-up on a communique that is designed by you, for you, so we go ahead. So let me first start with Tamarise, the person on the left of Tamari, James Fowler. James, you've obviously had some expectations. You've seen how the team and the delegates have deliberated over the last 3 days. I'll really be happy to get your reflections as we chart the way forward. Over to you, James.
There we go. Thanks. Well, first of all, I just want to say it's been an amazing experience to be a part of this summit and to have the opportunity to just sit here and listen to the conversations. I'm very encouraged by the conversations that I've heard over these 3 days, and I very much hope that this can be a starting point. I think that throughout all of these conversations, I heard a number of threads that I think can make up the fabric of a truly robust vision for health security and countering emerging health threats in the East Africa region. So I think it's really important when starting on a journey like this that we do two things. We have a firm vision of where we're going, right, to the top of that mountain, and we know exactly where that is and what it looks like. And then we know what the first few steps look like. And everything else, that intermediate period, we can figure out all of the rocks and hills and valleys and everything else we're going to have to cross when we get there. But those two things I think are really important. And it struck me, we were speaking at lunch today about the analogy of a fire, which it only takes one spark, which can start a huge blaze. And then what do we do to respond to fires? And in many ways, fires are a great analogy for epidemics and pandemics. And so I think we tend to be fixated on building and creating the fire brigade, right? The fire department that's going to come and save us and respond to the fire. And in some ways, some of the things that we talked about today really are the fire brigade, right? Manufacturing capacity, vaccines, those are things that are necessary. We have to have them, but they arrive late, right? So if there were a fire that broke out in this room right now and we were to evacuate and call the fire brigade, I don't know how long the Mombasa County Fire Brigade would take to get here, but probably a number of minutes, right? By the time they were here this room would already be engulfed in flame, right? And their job would be to maybe prevent the rest of the hotel from catching on fire. But fire is an interesting analogy because it's not only the fire brigade that's involved in saving us from the impact of fire. If you look around this room, just take a look quickly at your environment, your surroundings. You'll notice there's a sprinkler system built into this room. You'll notice that there's smoke detectors. There's actually lit exit signs over the doors. I noticed there's fire extinguishers in the corner here and over there. Actually, the ceiling tiles are built to a specific standard so that they will retard fire and not ignite easily. All of the materials in here. So rather than the fire brigade, this building is built to resist fires, and if a fire starts, it's built to prevent those fires from spreading quickly. And it also has the ability to fight fires. There's fire extinguishers here. Again, there's actually a water source and a hose just outside around the corner, right? And so those are built because of standards and codes that have developed over a lot of time. But who pays for that? Who paid for all these things? We did.
We did, yes.
All of us did. Every one of us, right? Every one of us who booked a room at the hotel, our group that booked this conference center. When I bought a Tusker last night after the dinner, right, a little piece of that goes into funding all of this. And all of this is because this de-risks insurance for this hotel, as well as insurance across the community, right? So there's a return on investment for all of these things. So first of all, that cost is passed down to everyone. We collectively as a community bear these costs to make our community as a whole more fire safe. And then businesses and insurers and governments are incentivized to implement these fire controls because ultimately it saves money. And that means lower fire risk, lower outputs from insurance companies. They can reduce premiums, right? So I'm sure this hotel gets additional insurance breaks if they put extra sprinkler systems in or they enhance the fire system above code. Why can't we do that for health and for pandemics? Why can't we create a system where all of these things, all of these threads that we've talked about today, enhanced diagnostics at the community level, enhanced communication and health literacy in communities, better baseline healthcare delivery so that it's sustainable during emergencies. Why can't we develop systems that capture those return on investments that are there and build that into the costs that we all agree to bear a small piece at a time every day in everything we do? I think that's a great vision for the future and something that the region can look at implementing together. And then for first steps, I think that what Tamari was just talking about, how do we educate and train the next generation of health security leaders who are going to be able to get us the data and the science we need to implement this, right? All of those standards are based on a significant amount of scientific research that's actually not done by governments. It's not funded by governments. It's done mostly by nonprofit organizations. The International Code Council sets most of these standards based on the data that they have. There are roles for public-private partnerships in forming those kinds of standards organizations, but there's definitely roles for academia in training the health security leaders that are going to be able to establish that type of system in the future. So those are our first couple of steps, but that's the mountain. That's the mountain that we're going to climb in the future.
Thank you so much. I think the mountain is clear. Prevention is better than cure. Set the standards, let the fire not start. But for primary health care, I don't think the Tusker will be the right thing to consume. But what you're saying, the more Tuskers we have, the higher the standards we can create.
Doing my bit.
But the point is that we all, I think James has made it very clear, let's set the standards so that we can prevent any of these emergencies coming. So Professor Rotich, your reflections would be very good before I move to Mugo, and then I'll go to Lucy. What did you find most interesting as take-home message in these 3 days?
What I found most interesting is really just the learnings from the various countries and the examples of what they do at the primary healthcare level. in terms of some of the best practices. And I think, for instance, the ECHO program that has been spoken about, again, utilizing technology, working with community health workers. There's been discussions about data and you know, like in Kenya, the community health information systems that exist that collects data. What are we doing with that data? So some of the conversations that have taken place here have, you know, that we can take forward include looking at that data, analyzing it, and then we see what that's going to do, I mean, what is going to inform the future of, for instance, further engagement for community health workers. So I think the data aspect has been really crucial. We currently also have the digital health, digital superhighway. Again, through partnership with government and private sector, something that has been really successfully developed, and a platform that is going to give us also a lot of the data that we require. Again, analyzing that data, letting it tell us what we need to do going forward. And I think there's been conversation also about artificial intelligence, you know, that enhances digital health. It's also important to think about how are we going to utilize AI for the future of health and even the future of global health security. The data that we require to support us with the identification of cases, issues around cross-border, you know, aspects that are going to help us to detect cases early. Again, the data is really crucial to help us to do that, and I think my learnings has been that we can strengthen that aspect to help us to move forward.
Thank you, Professor Rotich. Data is very, very critical. Let me move to Mugo Kibati. Mugo, there are several countries from our neighborhood who are here. You know this is the inaugural event. From your leadership reflection, I really want you to talk to the healthcare people who are sitting here, what to be mindful of, or share your reflections on how we can strengthen the progress towards a stronger, healthier, safety, regional strategy. And that's why this is called the Health Security Summit 2025. So please tell us what you think and reflect what you've heard so far.
Thank you. Thank you, Amit, and good afternoon, everybody. Let me also first start by thanking all the organizers of this forum for inviting me and for achieving an amazing fit in setting this up. I remember talking to Dr. Nzai and James here a few months ago when they began thinking through this, and I think it's amazing that you've actually achieved it. First, let me say I am not a medical professional. I think on this stage, I think I'm the only non-medical. My training really is in engineering, economics, and finance. And even though I've been, I got really immersed as chairman, as founding chairman of BioVax, in a lot of lingo and terminology of the medical fraternity. And I say this because I feel or I believe that whatever we're discussing here or whatever we're discussing in the health sector must be in the context of a larger macroeconomic and macropolitical context. And I think we would fail miserably if we do not understand that, appreciate that, and do something about it. Because, you know, we had a former leader of this country yesterday who indicated that we've recently received a wake-up call with what is happening in the US. But the point of fact is that we've had these wake-up calls for years, for decades. In my view, every 10 or 15 years, we all celebrate some leader telling us, you know, we've got a wake-up call, and then we go back to slumber and do nothing about it. There's absolutely nothing earth-shattering. There was no epiphany yesterday. And there's nothing earth-shattering about what's going on in the US. We've had this many, I mean, the pandemic, the COVID pandemic in and of itself was a wake-up call. And I must commend the team here, that at least you're doing something about it. Where's everybody else? Where are the leaders who are challenging us? Where have they been? We need to make sure that from this conference, as we move out, we don't have another wake-up call in 10 years' time. And we actually get to self-reliance. On this continent, we have Africa, Vision Africa 2063. It was launched with a lot of fanfare. I rarely hear it referenced, mentioned. It ought to be at the center of discussions, including what we're discussing here. We here back home in Kenya have Vision 2030. And on a point of personal privilege, Amit, because obviously I'm biased, I always say, when we launched Vision 2030, it was about self-reliance. That was a good 16 years ago. We in this country, and I dare say, a number of countries in this region, because I am aware and I engaged Tanzania on their own vision, South Sudan on their own vision, Uganda on their own vision, Rwanda on their own vision. This is about 16, 15 years ago. And we seem not to have a knack, except in instances where we have one, let me put it charitably, one continuous leader for many election cycles. Outside those contexts, we seem unable to sustain a long-term vision towards self-reliance. And I think we must challenge ourselves, and we must challenge the leaders who come on this stage and challenge us, especially political leaders. Vision 2030 right here has been implemented in fits and turns. Certain elements of it better than others, some completely forgotten, but what is most important, the lack of a holistic approach. So that macro context, if not addressed, makes the efforts of the healthcare professionals in this room very challenging and very daunting. We've had, the Abuja Declaration. I don't know how many countries have hewed to it or even tried to, because healthcare is, perhaps in my view, in terms of any political leadership, healthcare and education are the most important political imperatives of any nation. And the question we must ask ourselves is that in the macro strategizing for our nations, for our region, how important is healthcare? So, going back to the so-called wake-up call, PEPFAR, I think PEPFAR has been very topical over the last 1 week. What's going to happen because PEPFAR is being, going to be impacted? Well, that acronym, PEPFAR, what does it stand for? If I recall correctly, Presidential Emergency. May I repeat? Presidential Emergency. Let me say that again. Emergency. 22 years later. Shame on us. And we're here crying. I think Donald Trump, if I'm sitting in his shoes and he's like, oh, what is this? This is a presidential emergency program for AIDS reduction, is it? Relief. That was launched 4 presidents ago by President George W. Bush in 2002. 22 years ago. Why do we need wake-up calls? It's an emergency fund. On this continent, we have a habit of turning emergency initiatives into permanent programs because we seem to be incapable of relying on ourselves. So I think it's important that we really look in, very deeply, take this opportunity to say an emergency is an emergency. Much like James is talking about the, not waiting for the fire truck, but actually doing and addressing the fundamentals that we have. Now, self-reliance, and I talk about self-reliance because BioVax was born out of a need, the experience of the COVID pandemic period, and the fact that we found ourselves on this continent at the back of the line. And we were rightly at the back of the line because we were not doing anything for ourselves. And we were relying on other people who have their own priorities. So this is very important in terms of security. And unfortunately, healthcare, and I think we've learned this, requires global interdependence. Global interdependence is important, but we must play our part. I look forward to the day that we, in the whole mosaic of global interdependence, we in the African continent shall also be looked up to do our bit. People will be saying, oops, the East Africans or the West Africans or the Kenyans or the Rwandans, they haven't done their bit. So back here in California, we have a bit of a problem because we were doing our bit. We must also be aware that there is raw nationalism that is emerging and accelerating around the world. In the West, that raw nationalism, where it's ask fast, born out of immigration issues and fears, because economy globally is changing. And I think those of you who come from the West are realizing that cheap labor in the developing parts of the world is becoming expensive and people have started doing stuff for themselves. But we also have raw nationalism here on this continent, driven mostly by resource suspicion. You know, we're becoming, including the continent, suspicious about foreigners and our resources under the earth. The result being, everyone is saying, me first. Right? It isn't just Donald Trump in the US. Right? It's Burkina Faso saying also, hey, wait a minute. We first. The minerals belong to us. The same way Donald Trump in the US is saying, me first. These jobs belong to us. How do we ensure that with this kind of raw nationalism, important, critical, necessary global interdependence doesn't get lost? I mean, if you look at the pandemic, the world had to work together. You cannot, especially in this sector, of all sectors, global interdependence is important. And so I think for me, Amit, as I conclude in terms of my reflections as an outsider, is one is to commend the organizers of this summit. It's long overdue. Two, I hope that the communique that will be read out and the resolutions that will be agreed upon will actually be implemented and reviewed over the years, and that we shall really sustainably not drop the ball and focus on attaining self-reliance on this continent and stop relying on emergency relief from outside this continent, which is never ending. I think we have the capacity to do it. We have the wherewithal to do it. I think we have the leadership, actually. It always befuddles me that at a technical level, this continent has tremendous leadership. You land in this conference, you look at the people sitting on this podium and the people in this hall, brilliant leaders who can lead anywhere in the world. But of course we fail when you get to the political level. And some of you healthcare professionals will have to get your dirty hands in politics, your hands into politics. And not to become politicians, but to convey to political leaders that their job is also technical, that it isn't about winning elections, it's about making sure that our children are well educated and are healthy. They grow up healthy, and that our citizenry is healthy and has access to healthcare on a universal basis. So let me say once again, thank you very much for the invitation. I enjoyed the brief period I was here, and I look forward to the legacy that will be born out of this conference. Thank you.
Thank you so much, Mugo. Your message to all of us on the journey to self-reliance is absolutely clear. Your message to the people who are in front here and sitting here, that you are the leaders, and many of our neighbors who have come from different countries are also in the leadership position in their own countries, talking to their own political champions to make a difference. I think that message you've given very clearly. Talking about the 14 countries now, let me segue to the leadership that sits here in Kenya, but truly responsible for the East African region. Dr. Lucy is, of course, going to be taking the reins on how we integrate ourselves within the East Africa region and continue with these resolutions and the communique that's coming. So let me pass it to you, Lucy, before we call on the communique coming up, to just give a little reflection of the size and the scope of your work. What support do you need from us? What help do you need from stakeholders? Which are the partners you'll be relying on? Because this team sitting here today is a testament that we are walking the journey with you. So please tell us what you'd like.
Thank you very much, Amit, for this opportunity. But before I go into speaking about my thoughts and my reflections on what is expected of us as the Africa CDC, but also importantly, what we expect from the different stakeholders, allow me to appreciate my team. I know in this meeting I keep getting the glory, but behind me, there's a lot of good women and men. I have 3 women with me here, Judith, Lucy, Esha, but there's also a number of great men and women at the office in Nairobi, as well as in the member states that are represented here. So thank you very much, ladies and gentlemen. And then I would also like to appreciate the most important people in the room, the representatives of governments. We have our minister here, and we have other high-level dignitaries representing the member states within our region. So the Eastern region has 14 member states, and it's a very dynamic region, because in this space we have countries that are in the space called the Indian Ocean Community. We have the traditional East African community members, and so on and so forth. We also have some countries who are facing humanitarian crisis. And so when we look at how do we support these member states, it's not a one-size-fits-all. And that's why it's important to have everybody around the table. I think there are quite a number of things that we've discussed through this meeting. But for me, I think I speak around 3 critical areas if we are supposed to safeguard our health on the continent, but more so in the region. One of those is the workforce. And I know prior to this that there was a lot of discussion around the workforce. And I think we're happy to hear that Amref University is up to the task to see how we can build this capacity within the region and on the continent. Just as we came this afternoon here, Dr. Kasolo and I got a message. One of our countries has just declared an Ebola outbreak. And again, started with a healthcare worker. When you remember the Marburg situation in Rwanda, who were the most affected? The healthcare workers. What is that saying? Is it our index of suspicion? I think we had another conversation yesterday with some people, and the emphasis was that the people who are in the surveillance epidemiology space have a different index of suspicion compared to those in the healthcare facility. So we need to align all these things, and we need to have deliberate policies that will push and ensure that the gap between the clinical area and the field area, the surveillance area, is reduced, if not closed. And so when we are looking at the workforce development, we need to look at what is the situation. The workforce in Comoros and the workforce in South Sudan, the gaps are different. So we cannot have a one-size-fits-all. Even as we have an agenda in the Eastern region that we have to have the correct workforce to safeguard the health of our people on the continent or even in our region, we must also get the detail at member state level. So that is why we have one-on-one bilateral relations with the member states to see what is the situation in their area and how do we move it. But, like has been said severally, diseases have no borders. So they all have to speak to each other. They're in the region. And what's the purpose of reinventing the wheel? It's possible when you have an outbreak like that that may affect the next country. Why can't you have the two sides having a joint capacity building activity? Because they need to understand the dynamics between the two spaces, if not the three spaces, depending on how you're bordering. So workforce development policies, I think, need a game changer in our region. Secondly, it sounds funny, when we talk about how yesterday His Excellency Ruto was saying, Kenyatta was saying, why are we crying over money that isn't ours? And we're laughing about it, we're happy it's gone viral, but are we really internalizing what that means? A number of countries have not reached their budget declaration of 15%. 15% of their budget aligned or assigned to the health sector. Most of us are even below 7%. Sindio, as they would say in Swahili. So we talk about these things. Every year, we speak about them, about how we need to strengthen our health systems, but based on whose money? So we need, as member states, to push an agenda to ensure that we have a decent amount of resources, financial resources, to support the prevention, first of all, the detection, but also the prevention and control and response to health emergencies. It has to be part of the budget. One of my staff said, oh my gosh, with this US issue, what happens to this country now that they have Ebola? And with Dr. Kasoda, we said, they should have a fund for emergencies. So we know these things, but what we need to do is do what? We need to implement them. But I think that also as a region, one of the policies that we can push is to see how can we have a regional fund? How can we have a pot where we can contribute resources? And because we have different vulnerabilities and different capacities, so that we can easily tap in, especially for those issues that are infectious and have the potential to cross borders. If we have this fund sitting there, then it can be accessed, but everybody has to participate. I think every day, every year, the countries are being reminded about their obligations to the Africa Union, about their obligations to the Africa CDC, their obligations to the EAC, and so on and so forth, even to WHO. But we are quiet about it. We need to move this agenda and be focused and committed to ensuring that we secure finances for our countries, but also for our region. So I'd like to propose that even as we think through this and go back home, that should be an area of discussion, and we see how we can take advantage of the Heads of State Summit to push an agenda for regional finance security, to ensure that we are able to respond to these issues timely. The third one, I think I would like to look at is the issue of local manufacturing. And I think my Director General sings that song everywhere he goes, saying that this will be our second independence. The other day, somebody talked about how the first country, Ghana, got its independence in 1958. That's how many years ago? 70? Somewhere there? And we are still heavily dependent on importing the supplies that we need. It's not just medical supplies, it's food, it's all sorts of things. We export the raw materials, and then they come back as you know, supplies that we need to use. There's a team in the exhibition, and they talk about how they're making beautiful, robust, strong gloves. I don't know if they're in here, but I wanted to ask, where are they getting their rubber from? Because 2 days ago, somebody was talking about how we are importing even the raw materials that are available. We don't see them. And so we have a country like Malawi that has a huge plantation of rubber. Where is their rubber going? Most likely off the continent. I'm not sure, but I'm just saying most likely. So our governments need to look at how do we incentivize one another to ensure that we access these resources within our region, within our continent. So there are issues of tax, there are issues of, you know, transportation. There are also all these enablers that are required to make sure that we take advantage of the resources that are here and build up on those to manufacture our medical supplies, our vaccines, and so on. But that doesn't mean that every country has to be the manufacturer of every vaccine. It requires robust infrastructure, it's costly, and so we need to look within the Eastern region, who has the comparative advantage to manufacture vaccines? Who has the comparative advantage to manufacture other supplies? And then we all join into that one supply chain. Everybody contributing to one thing or another, and not feeling that I'm making somebody else rich without me getting anything out of it. So a regional approach is key and critical as we look into those areas. But I have a last one. Sure. Mugo talked about multi-sector approach. Believe you me, in every meeting, we emphasize that. Oh, we need to do a multi-sector approach. Oh, One Health approach. But are we living it? Is the crisis. So I think that even as we go back, if we can start at the technical level, ensuring that this One Health approach works, then we can push it up even to the political level. Thank you very much.
Thank you. So in conclusion, as our chairman prepares to officially present to you the resolution and communique, we've learned from the panelists a few real take-home message from Professor Rotich. I think the idea about data, information, and evidence-based approach to our health security is clear. She talked a lot about how we need to even gather very accurate information from the community, which came up in many of the sessions. So I think data and science is important. From James, we heard the whole idea about have a vision. We should know where we are going. We should have clarity on the way we're going to progress to the mountain. But he was also very clear that we need to maintain standards. And those standards, we use the analogy of the fire. And what you saw around this room could be equated to the primary healthcare services that we need in all our countries to be strong and robust, not to be tested by emergencies and pandemics. Mugo really talked about the macro-political and the macroeconomic lens. We should view this holistically. And he really brought out the leadership in us and the leadership that we need to engage to move this program forward with, again, the clarity that we need to look at how we're going to be stronger as a sector and learn from, again, with the partners that are in the room. Mugo was also very clear about self-reliance and it's time. I think he's also echoing the words of our fourth president on how we can become really, really looking and be stronger on our journey to self-reliance. And I think to crown this, Lucy spoke about 3 key aspects that we all must go together. Let me repeat them. And I wonder if it resonates with our brothers and sisters from the 14 countries. And if it is housed at Africa CDC, then each one of those 3 or the 5 will have an action committee. And I know the Africa CDC team is here. The first thing she really spoke about is HRH. I think you spoke about the HRH, human resources and the skills, and we need to train the right number of people at the right time in the right space. And so we need a dedicated action plan on HRH. Maybe we don't make the HRH ourselves, but we should share the HRH between the 14 countries. And we could bring in the whole aspect of e-learning and telemedicine around HRH and skills. And we referred to AMREF as one of the training entities as an example, but there's so many academic centers of excellence. The second thing is we need to have a structured engagement on financing. People talked about bonds, they spoke about health bonds, we talked about affordable capital, we spoke about equity, everything to do with the pandemic fund. And if we can get the East Africa Health Security Pandemic Fund, it becomes so attractive to many people outside Africa because they know in the long term the returns will be healthier. So are we going to be innovative beyond knocking at Treasury's doors every 6 months? Every ministry official here will tell you that Ministry of Finance thinks health is a good waste of time. And you know, they think it's such a boring sector. And you guys do nothing for economy. And you don't really help people get richer. Health sector is a fantastic poverty promoter. And when I build a railway, and when I build a road, and when I build trade, people flourish. Children are happy. But when I buy just medicines and employ staff in healthcare, it's taking up all our money. And then we go back to Treasury and say, but you know, sir, when you give me $1, the country gains $8. They say, is that true? Is that a fantastic lie? I don't see any study and I don't see anybody convincing the Treasury that it is worthwhile investing. All of you are facing it. Is that true? And all these ministries will tell you, if you are going to tell them, give me 15%, some of the challenges we get. In fact, next time, Chairman Zai, let's call Ministry of Finance. They need to be in this room. And they should be telling us that you in the ministries of health, if you use the money given to you effectively, then we can give you more. If you got 5 today, show us you use the 5 well. I give you 6, I give you 7. But if the news that we get in these 14 countries that health funds are being misused, then we have our own selves to blame. I don't think anybody here will tell you that we need more money for health. We need more money for health, but we also need more health for the money. So I think we need to hold ourselves as accountable officers to prove that we can use the money effectively and bring more financing. The third part you talked about was local manufacturing. And I think Lucy made it very clear that local manufacturing will be an active. I also saw UNECA here. I know if they're here, but UNECA is a great partner. AFDB is a great partner. The World Bank is here. We need, again with WHO and Africa CDC, to intentionally design local manufacturing, and maybe we do mapping, like we spoke about earlier. Let's map what we are producing in these 14 countries. Let's map to show what percent of commodities are being consumed by locally manufactured 14 countries in East Africa. And then, after 5 years, we talk about whether we've changed the scale. Or in 10 years, we can look, is it changing, or are we still becoming a trading zone? East Africa, the largest trading zone. Buying from China and India and selling it to East Africa for consumption. I'll add 2 more points before I call Chairman Zai up here. The 2 points that have also resonated in these 3 days is creating an enabling environment, a policy shift. Each country present here today should examine all the policies in their countries, whether you are from East Africa or West Africa. And when we meet in Kigali and Abuja and in Rabat, these 3 cities, we should be analyzing where are your policy shifts, where are the gaps, and we should be sharing with each other the policies that are creating an enabling environment for health security. And finally, I think I've heard it so many times, and I'm really proud that everybody is saying collaboration is the new innovation. And partnerships, I think, are the corner and the key pillar on how we will be able to work together with the East African region. So ladies and gentlemen, please put your hands together for the panel that's here and for our way forward and for yourselves as we ask the team to sort of clear the stage for that. And of course, may I invite them in front to take a picture. Cliff, you can take over and prepare for Chairman Zai to do our finale. Thank you.
Thank you very much, Amit, as well, ably moderated. Please give them a round of applause. This marks the end of the final panel that we're having today. As we clear the stage, ladies and gentlemen, which will be sort of moving into a closing ceremony. First, allow me to make a key announcement. There's someone who's lost their phone, please. So let me not go home with a new iPhone. Please, if you've lost your iPhone, kindly reach out to me as well, so you can have that. So allow me now to specially welcome our convener, Dr. Zai, on stage, who will in turn invite a few speakers and of course read the Mombasa Declaration.
Thank you. Good evening, everyone. Man. Maybe. May I just ask everyone to just stand up? Just a bit.
Check mine. All right, so you guys remember the coconut move, right?
So
the CO.
As he's doing that, mine will be very, very short. There's a video that will be playing, and then when he's done, you guys can sit and you just watch that video. So go ahead, Cliff.
All right, so let's go. C to the right, to your right, ladies and gentlemen. C to the right. Okay. O. C to the left. O again. N. Oh, wow. You follow instructions quite well. T. All right, let's do that. I was just say C-O-C-O-N-U-T. 3, 2, go. C. T. Very good students. Thank you so much.
So, ladies and gentlemen, we've come to the end of our. You can download that and think about it, but I think everything that we said, it's exactly that. But from the Vision 2030 side and the Vision 2030 board, and much of the thinking of Kenya, that's why we have long-term plans. Short-term plans do not work, and we realize that a pandemic in Africa today, or for any country, for any community, is a threat to economic development as we have had it. And it's our biggest threat probably that we have more than a war more than anything. So I think the rallying call is there. And so from the Vision 2030 side, and on behalf of all my team, which is here, the committees which were formed, we want to thank you. So at this point, I want to just have all the committees who were involved in this summit, in the preparation, all the partners, please stand up from wherever you are. I know most of them have probably gone out to take planes, but please stand up. University of Nebraska, AMREF International University, MOH, Grace and team, all of you. Tuwapigie makofi. Africa CDC, I don't see Africa CDC is here. Very good, very good. So thank you so much to all of you and all the panelists who are here. We came here with 3 main objectives. That we will catalyze a conversation for strategic partnerships. I think we've achieved that. Have we? Yeah. You've made contacts by yourselves, right? You have business cards. If you have only 2 business cards or 2 contacts, you've not done your work, probably you need to do better. If you can meet at least 10 people and have business cards and have a conversation, then you'll have achieved something. And that could not have been possible if you did not get to do this. We said we'll have some action plans. There were some calls for actions which came in all the way to the last, some repeated many times, and that have been all documented for us to be read. We said we'll do knowledge sharing, led by our thought leaders, the universities that we have, University of Nebraska, AMREF International University, and the experts that came from many different parts. And we've got to do that. We are left with those actions and what we will do. So talk about those actions. The rapporteurs, the experts have all synthesized and come up with a whole document, which is our presentation now to the member states, the Africa CDC. We handed this document to Dr. Lucy Mazianga, the Africa CDC East African Region Lead, and we are asking her to come and read that document because now she owns it with her member states. Tumpigie makofi tena.
Good afternoon, ladies and gentlemen. Am I the one standing between you and the beach? Oops. I'll be quick. So, there's been a lot of discussions, a lot of talk, a lot of talk. But we need a way forward, and we need to hold people accountable. So, member states, we've drafted something on your behalf for your approval, and we hope that you can approve this because this will help us indeed to move the agenda forward in securing the health of our countries and our region. This is how the communique goes. We, the 9 participating member states of the Africa Union Eastern Africa Regional Coordinating Center, these include the Union of Comoros, the Federal Republic of Ethiopia, Republic of Kenya, Republic of South Sudan, United Republic of Tanzania, and the Republic of Uganda, in a meeting held from 28th to 30th January 2025 at the first East African Region Global Health Security Summit, which included representatives from multilateral organizations, non-governmental organizations, academia, and the private sector gathered in Mombasa to address the critical and urgent challenges to health security in the region. Mindful that the Africa Union Eastern Africa region is home to more than 400 million people and faces unique challenges due to its diverse health and environmental dynamics. Also, recognizing that health security is a member state responsibility with a shared regional, continental, and global responsibility. And it requires strengthening collaboration, innovation, and resilience to safeguard the health and well-being of all people in the Eastern Africa region and, of course, beyond. We also think that we should acknowledge the growing impact of health emergencies like the Ebola virus disease. Today we've just heard of an outbreak, HIV/AIDS, malaria, tuberculosis, Mpox, and Marburg virus disease on our vulnerable populations in the East African region, and the urgent need to improve disease surveillance, response, health systems, workforce capacity in epidemiology, research, and local medical production. Also acknowledging that the resource and financial gaps that highlight the need for sustainable, innovative, and predictable financing, partnerships, and multi-sectoral collaboration for health security. We also acknowledge that the critical role of stakeholders, be it global or regional bodies, private sector, academia, government, civil society, and indeed the communities we serve, in strengthening health security and response. The work of the Africa CDC and its Eastern Africa Regional Coordinating Center, WHO, and indeed all the health sector partners to enhance health security by coordinating surveillance, preparedness, response, and health system strengthening across Eastern Africa is acknowledged. We also acknowledge that Africa's dependence on imported vaccines, diagnostics, therapeutics, and health products exposes the region to significant vulnerabilities. Having acknowledged those, we, with you, want to reaffirm that universal health coverage is crucial to global health security, and that there is a need to honor commitments from regional and continental forums, including the 2017 AU Declaration, the 2016 Malabo Declaration, the Lusaka Declaration on Public Health Emergency Operations Center, and indeed Agenda 2063. The importance of equitable resource allocation, timely disease surveillance, and robust health systems as cornerstones for effective emergency preparedness and response is reaffirmed. It is also reaffirmed that the health security relies on addressing interconnected factors like climate change, migration, culture, crisis, conflict, and indeed global movement, which drive disease spread. My representatives from the member states would like you to commit to the following: to strengthen regional health coordination and collaboration, And I know that we play a big role in this, and that is the reason why we have the regional coordinating centers in 5 AU regions. And the reason behind this is to ensure that we coordinate stakeholder efforts across all 14 AU Eastern Africa region member states and enhance Africa CDC's role in the health prevention, preparedness, response, and health systems. So don't block us out when we're coming to your countries or when we're calling you to the important governance meetings such as the RESCO and the RETAC. We would like you to commit to enhancing or facilitating the collaboration among all of you in the Eastern Africa region. And also to enhance collaboration with the regional economic communities and the partners. WHO is our big brother, and we've been having, recently in the MPOX, we've had a joint plan, and we're hoping to go further. And there are so many others. We've spoken about the academia, we've spoken about the private sector. So how do we collaborate all these? You need to provide an enabling environment to ensure that this collaboration is successful. Secondly, we wish for you to commit to strengthening health systems to deliver primary health care for universal health coverage. How do we do that? Or how do you do that? Invest in workforce development through training, capacity building, and retention of healthcare professionals in workforce development and recognition. We need to build resilient infrastructure for health security and ensure that health systems are resilient and accessible to all population, particularly vulnerable groups during health emergencies. And I see why Amit was insisting we should have had Ministry of Finance here. We wish for you to commit to promoting innovative, sustainable, and predictable financing by mobilizing domestic resources through innovative financing, including collaboration with financial institutions, by engaging partners and advocating for sustained health security funding in the Eastern Africa. We hope that when you go home, you will speak to the policymakers about us coming up with a health security funding mechanism for our region. This will enhance health emergency preparedness, response, and health system strengthening. We also feel that you should be able to facilitate the establishment of contingency funds to promote and effectively respond to public health emergencies within your member states. Addressing emerging and existing threats is another area we would like you to focus on and commit to prioritize strategies to combat emerging threats such as antimicrobial resistance, climate-induced crisis, and emerging infections. Leveraging on innovation and technology, we wish for you to commit to embracing digital health solutions to improve disease monitoring, data analytics, and service delivery. And I think most of our technical people articulated this matter and would like you to commit as the leads in your health sector into ensuring that this happens, to ensure equitable access of vaccines, therapeutics, and diagnostics through innovative procurement and distribution strategies. I think the Africa CDC has been talking about bulk buying, even as we move the agenda on local manufacturing. Before we get to that 60% of local manufacturing, we need to see how do we bulk buy, regionalize that, so that everybody can have quick access to the medical supplies. In the long term, local manufacturing for health products. We wish for you to facilitate and commit to enhancing local manufacturing of vaccines, medicines, and medical devices with the goal of producing what I just mentioned, 60% of the continent's need as a region. Like we said earlier on, not every member state must produce the vaccines. Somebody must do the R&D. Somebody must manufacture the needles. Somebody must manufacture the bottles where we put the vaccines. But we are all part of that chain that at the end of it all, we all have access to the vaccines and other medical supplies. To support the stakeholders, especially the private sector, for sustainable local manufacturing across the region. To establish an environment that facilitates buying of local health products and technologies. And that's where we say we provide an enabling environment. And that's why you must be speaking to Ministry of Finance, to the Revenue Authority, and so on and so forth. Because, of course, this is not the responsibility of the health sector, but it is key for us. And so we need to talk to the relevant stakeholders. And importantly, to strengthen public-private partnerships, coordination, and mechanisms. And I think you've met some of the partners that are key and critical to the local manufacturing agenda, and we need to move this forward. We are also asking you to commit to advocating for representation. We ask you to advocate for equitable representation and resource allocation that addresses the unique challenges faced by most, if not all, African nations. To advocate for stronger health security policies by prioritizing IHR, regional integration, and policies focused on equity, sustainability, and self-reliance. Your Excellencies, we need you to commit to promoting research for health security, to be able to strengthen health security through research and innovation, investing in diagnostics, telemedicine, and preparedness tools. We need you to facilitate partnering with the academia, the international researchers, and indeed the private sector to enhance regional research capacity and tackle Africa-specific health challenges. We need information from Africa to help us find the solutions for Africa. Lastly but not the least, we're hoping for you to commit to impact accountability, to ensure that you follow through these actions from the summit. And to do that, we have suggested that we will form a technical team co-led by Kenya Vision 2030 Board and the Eastern Africa CDC Regional Coordinating Center, supported by other stakeholders such as our big brother WHO, the universities, the private sector, and hoping that this translates the summit's actions into implementing the following. The Eastern Africa Regional Global Health Security Summit report will be presented and advanced. The EARGHS report will be presented, and this will advance implementation at the Agenda International Conference in Kigali in March 2025. We will launch calls for application of the Africa Global Health Security Fellowship to be run by Amref University. Also, the Global Health Security Hackathon, and indeed the joint grant writing. Under the impact accountability, we also aim to focus on advancing the conceptualization and structuring of the Eastern Africa Global Health Security Fund, and also to advance the partnerships with the University of Nebraska, the Global Center for Health Security, to establish Africa Center for Global Health Security. Your Excellencies, ladies and gentlemen, all protocol observed, this is now you, I'm speaking on your behalf as member states, and I hope you will stand and agree with me. But maybe you can stand already, and then those who won't agree will sit. And some of you in here are also members of the member states. Do you belong somewhere else? We, the member states and participants. Okay, if you are not a member state, you are a participant. Let's stand. Those who don't agree will sit down. So let's all stand. So, we, the member states and participants of 2025 East Africa Regional Global Health Security Summit, with the support of the Africa CDC, WHO, and partners, reaffirm our shared responsibility to promote, provide, and protect health in our region. We commit to translate these pledges into action by fostering collaboration, strengthening national and regional institutions, and advocating for sustained investment in health systems. Together, we can build a resilient, healthy future for the Eastern Africa region and indeed the world. So for all those who are in agreement, we remain standing. Those not in agreement, you are allowed to sit. Yes, 100% endorsement. Thank you very much, everybody. You may take your seats, and we will share this for your digestion further, but also just to thank the unique workforce in Amref University, in Africa CDC and WHO for coining this important communique, and also to thank all of you for standing up for it, and we look forward. When we meet in Comoros 2026, we will be saying the train has moved. Thank you very much. So I have the honor and privilege to invite my big brother, literally actually, Dr. Kasolo, but also as WHO, our big brother, to please come and give his remarks.
Thank you very much, Dr. Mazaba. A little story that Dr. Mazaba was one of my brilliant staff in Zambia, and of course also worked to ensure that she got all these good qualifications that she did by being one of our lecturers during our training. But she's made it, and now I take off my hat and say, well done, Mazianga. I notice you've modified your name here. They're referring to you as Lucy. She is normally called as Mazianga. Yeah, Mazianga Lucy Liwewe. Oh, sorry, Mazaba.
Ladies and gentlemen, the honorable ministers, representatives from countries, our dear partners, our sister agencies, the Africa CDC, and all protocols duly observed. Indeed, when we were coming for this meeting, most of us will confess that we were not sure where we were going to land. But I must say that first of all, the organizers of this meeting really did a wonderful, wonderful job. I've been to many meetings, but this was one where you felt welcome, you felt that you were learning from others and genuinely discussing issues that affect our sub-region and indeed our continent. Our colleagues from University of Nebraska, I think, made the meeting even more juicier. Of course, the people from the continent, from the different entities, the AMREF international universities, the private sector, enriched this meeting to an extent that I would safely say if we had one or two of our difficult presidents, that we would have turned their attention to what global health security really means. We've had many, many meetings around global health security, and I think time has come for us to start moving forward and ensuring that what we've discussed in this meeting are implemented by our countries. Indeed, our countries should take the leadership in ensuring that what comes from the recommendations read by Dr. Mazaba are translated into action at country level. We from the have the responsibility to also ensure that what we preach to countries or what we talk to countries on incorporates some of these rich discussions that have come out of this meeting. The local manufacturing should not be just a slogan. We've heard how we were left behind as a continent when COVID came. This should never ever be allowed to occur because we have the capacity, we have the resources to turn around what happened from COVID in terms of local manufacturing to making it a reality on our continent. When we talk of countries, we talk of people. And if we don't involve our people in the country, our communities in the country in fighting, in strengthening health security, we will be failing. And so again, one of the big messages I would like to put across from the World Health Organization is that our investment in communities and indeed primary health care, in gender issues as we fight emergencies and outbreaks, are very important, and that we should really ensure that these forgotten issues like gender, mainstreaming into health security should be actualized. And of course, we need to put our money in everything. Even if we put 100,000 shillings and we say this is coming from the government of Kenya, it is our money. We can decide how we use it. And so again, encouragement to the countries, don't look at the money that you put in as not being enough. It is how we use that money to push things that will make a difference. Most of our countries pay salaries. That's a contribution that you make in health security and health response. Most countries set up infrastructure. That's a contribution that you are making in ensuring health security on our continent. What we need to be doing is to ensure accountability, that those infrastructure are being put as close to the communities as possible. Days are gone of building huge 2,000-bed hospitals. I think we need to get small facilities, health facilities, near to the communities where they can walk within the shortest possible time. And also, those facilities must be manned by qualified persons who have linked to the community. Lastly, I'd like to again congratulate all the organizers for this wonderful, wonderful meeting. We've taken notes. We're going to look at what has been suggested, and certainly we're looking forward as an organization to joining you again in similar meetings. Not only joining you, this time I think we'll come more than the numbers that we came, to fully participate in all the aspects of these meetings that we've had. We commit as an organization to continuing this discussion, to supporting member states, to also working with all the partners, including civil society, in ensuring that health security is strengthened on our continent. And never again will Africa fail to respond to whatever new pandemic or old pandemic that may emerge. I thank you.
I don't think that's how we clap for a professor. Thank you very much. To actualize this dream, many people had to put their heads on the table. And we're glad that it's worked out well, from the smiles on your faces, from the interactions that we had. And so one of the critical organizations to the success of this event, first of all to the birthing of the event, and to ensuring that it goes beyond the neonatal ward into where it is today, is the University of Nebraska. And so I'd like to call upon the Chancellor of the university, Dr. Davis, to come and share a few remarks.
Thank you, Dr. Mazzolo. I have said a lot already. What I do want to say is thank you. Thank you for the opportunity to partner with you. Thank you for welcoming us with such great warmth and hospitality. Thank you for your interest in promoting health security in Eastern Africa and the whole of the continent, and helping to promote global health security. Thank you for having the courage to take the leadership and having the courage to know that the road to success is filled with failure sometimes, and not being afraid to fail early, but learning from those failures so that you can actually emerge stronger. And I think that, again, I make the point that this is a momentous time. It's it's really a pivotal time in the history of East Africa and of Africa. To get this right, you're going to really make a difference. And I want to congratulate all of you, all the planners, from Dr. Zai, and all protocols observed, every single member of all the different countries involved. You truly have put on an extraordinary meeting, and I look forward to seeing extraordinary results in the future. So thank you.
So this conference or summit would not have been called Eastern Africa region, right? If we didn't have representation from the member states in the region. So on behalf of the Eastern Africa regional ministers and their ministries, I would like to call upon Honorable Dr. Nasua Hossein to come and give his remarks. I hope you have your French ears open.
Je vais parler en français. Excellences, mesdames et messieurs les chefs de la délégation de la région,
my fellow ministers, ladies and gentlemen,
ma sœur, Madame Dr Lucie, directeur de l'Afrique Sud ici,
Madame, the Director of the Africa CDC,
Mesdames et Messieurs le directeur,
ladies and gentlemen, directors of different
Mesdames
organizations,
et Messieurs les représentants du corps diplomatique,
ladies and gentlemen, representatives of the diplomatic corps,
tout protocole observé.
all protocol observed.
Bonjour.
Good evening.
Permettez-moi tout d'abord de remercier les organisateurs de ces sommets du haut niveau.
Allow me to first thank the organizers of this summit,
mais aussi de l'accueil particulier et chaleureux qui a été réservé, nous en tant que délégation dans le pays frère de la Kenya, en plus particulier dans la sœur ville de Mombasa.
and to also thank you for the very warm welcome that we have received, all of us as participants, especially to this beautiful town of Mombasa.
Ce sommet nous a permis de tirer des expériences, des échanges.
This summit has allowed me to experience different, to learn different things, and enjoy quite an enriching experience.
Lors des anciennes pandémies qui nous a frappés pour le continent, surtout pour l'Est de l'Afrique, mais ça nous a aussi permis aussi de voir des orientations et des échanges vers des futures pandémies.
It has not only enabled us to see what is happening at the East African region, but also to get learnings about what followed after the COVID pandemic.
Si je peux résumer en 3 points, on a parlé de mesures de prévention, de moyens de diagnostic et on a parlé de traitement.
If I can summarize some 3 points that I've picked, it will be the diagnostic measures, treatment. Répétez les 3 points, s'il vous plaît.
En 3 points, on a parlé. Premier point, on a parlé de mesures de prévention, à savoir la communication, la surveillance, l'éducation, l'information. Ce sont des moyens de prévention. Mais on a aussi parlé, tu peux traduire?
We have spoken about the methods of prevention, the methods of surveillance, and also the treatment of the diseases.
Mais on a parlé aussi le moyen de diagnostic qui nous permet de rénover, accréditer nos laboratoires.
We have also discussed the diagnostic methods that can help us also improve our laboratories.
Mais aussi le traitement.
And also the treatment.
Donc, sur ce que moi, en tant que membre au pays, comme Madame la directrice vient de le dire, la pandémie ne demande pas de visa.
As Madam Director has said, for us also as member states, the pandemic did not require a visa.
Voilà pourquoi le sommet les résultats et les recommandations de ce sommet doivent être suivis.
Therefore, the recommendations, the learnings of this particular summit and the recommendations should be followed. There should be a follow-up action.
Les conclusions que j'ai tirées ici, ça montre qu'il y a dans la région de l'Afrique, il y a des professeurs, des docteurs expérimentés, chevronnés, qui peut mettre en œuvre la santé de la région.
And also, it's nice to know that seated among us here are professors and doctors who can help us to advance the health of the region.
En collaboration et en unité avec les autres partenaires techniques et financiers, bien sûr.
Of course, with the partnership, with the support of all the financial and technical partners that are present.
Et je ne vais pas être long, mais sincèrement, moi, je remercie les organisateurs, Et je remercie encore de nouveau ceux qui nous ont permis d'échanger, de voir l'expérience sur la ville de Mombasa.
I'm not going to take very long, so allow me to thank the organizers for having allowed us to have a good experience and see basically the beautiful town of Mombasa.
Vous savez, mon pays, c'est l'Union des Comores, un État insulaire et exposé aussi aux risques climatiques et des épidémies.
As you know, my country, Comoros, is a state that is very insulated. It's as an island, and that we also had to undergo the risks of the pandemic.
Mais on a quand même des similitudes. La sécurité et la santé, la sécurité qui est aux Comores et l'unité, ça nous pousse quand même à voir l'égalité entre la ville de Kenya.
And we also have faced similar changes, similar challenges on security and health, and also towards unity as the same as Kenya has undergone.
Et sincèrement, avant de clore, on a parlé beaucoup des épidémies, mais on n'a pas aussi parlé, il faut que l'Afrique de l'Est prenne aussi en charge les maladies, les comorbidités. Il y en a ceux qui ont parlé de maladies tropicales négligées. Il y en a ceux qui ont parlé de maladies chroniques. Il faut qu'on pense aussi à cette communauté parce que ça fait partie de nous et ils sont en souffrance.
During this time, we know that we did not talk much about the tropical diseases and the other diseases that are neglected or forgotten. And we should definitely think about also discussing the same in the future.
Et je disais que tout à l'heure, mon pays a de la richesse et ces richesses, c'est la paix et la sécurité. Voilà pourquoi je vais plaider à travers des États membres d'organiser le prochain sommet à l'Union des Comores.
And as I told you earlier, our country, Comoros, has a wealth, and this wealth is the peace and security. And it is for this reason that I would like to invite you to have the next summit in Comoros.
Donc, sur ce, je vous remercie.
Therefore, I thank you, and I will be waiting for you. Thank you.
Merci beaucoup.
Merci beaucoup, the Excellence, Dr. Hussein. Trying. By next year, I'll be speaking better French, I promise you. So, before I hand over to the MC, can I have my slide? So they say images have a lasting impression, and I thought the last few words should be in image form. And so when you see this picture, what do you guys see? Solidarity, good. Oh, powerful women, Prof says powerful women, nice. Sorry? Everyone is smiling there, right? So even through our challenges, we must smile and motivate ourselves to do better and ensure that we go through those challenges and make a better life for ourselves as individuals, but also for the communities that we serve. Next slide. The last 5 words for you, or sentences to carry with you. Local manufacturing. Next year, 2025, we must be at a different level. Empowering the workforce. Amref University, you've promised to ensure this happens. Improved health financing. Ministers of health, you better work well with ministers of finance. Strengthen communication and collaboration. And I think, in fact, yesterday, Mzee Kenyatta emphasized on the issue of communication. Adapting a One Health approach. Let us live it, not talk about it. Next slide, please. And the last slide. So I was in Arusha a few weeks ago, and I saw this beautiful piece of art. And when I got close to it, those are human beings. To get to the top, we need to hold hands continuously, as we start at the bottom until we get to the top. If any of those hands gets loosened, everybody falls. So together, let's ensure that we do not leave anyone behind. With those few words, I would like to declare this meeting closed, or rather deferred to adjourned, right, to 2026 in Comoros. Thank you very much.
And without further ado, ladies and gentlemen, mine is simple to give us guidance in how we'll move from here. Please give yourselves a round of applause for making it this far. I want to especially thank each and every one of you and the team behind the scenes, as I mentioned yesterday. Asante sana for all the support to making this happen. And there you have it from the MC. I'm saying thank you very much. Till we meet again. Kwaheri ya kuonana. For now, we'll just do a quick sort of a group photo. We'll do the national anthem. After the national anthem, we'll have a surprise. And then I'm trying to see if we can have you all on stage, okay? So I know I'm being ambitious, but I'd like us all to warm up and come on stage where we can take a grand photo. So please, shall we all be upstanding for the Kenya national anthem? Thank you, ladies and gentlemen. Since you're all upstanding, just leave your belongings there. Kindly make your way to the front, please. Make your way to the stage. DJ. Short ones to the front, tall ones to the back. Check, right. All right, good people. All eyes. All right, good people. Are you ready? Are you ready? Awesome. So please, I'll wait for the countdown. We'll take a video and we'll take a photo. So all eyes here, okay? All right, so who will direct on this side? All right, in 3. All right, ladies and gentlemen, are you ready? In 3, 2, 1, let me hear stronger together, okay? Are you ready? All right, ladies and gentlemen, in 3, 2, 1. All right, so we have those of us who have the flags. So I'll give you another countdown for you to wave your flag, okay? All right, guys. So in 3, 2, 1, let's wave our flags, please. Thank you, ladies and gentlemen. See you at the next summit.